Hi, my name is Dr. Lou Jacobs, and I'm about to show you one of the dumbest commercials I've ever seen. This lady in the white lab coat on the screen here is about to try to sell you anti-inflammatory medications for triggers that lead to migraine headaches, according to her. As I will explain to you, much of what she's saying here is not really being, she's not really being completely honest, but she's hoping that maybe you'll qualify yourself or classify yourself as a person who has some of these potential triggers, and you'll purchase their medication. I'm going to start the video after the introduction because not much is said there, and I'm going to interrupt her as I see fit and tell you the truth. So here we go. Get ready for this catastrophically, clinically inept commercial for anti-inflammatories.
By avoiding your individual triggers, you can often keep a migraine from getting started. Potential migraine triggers are quite varied, and they include stress or emotional issues, hormonal changes, physical factors such as overexertion, sleep disturbances.
Stress or emotional issues? Stress and emotional issues? You know what kind of headaches those cause? They cause stress and tension headaches. There's a name for those types of headaches. Those aren't migraine headaches. Those are tension headaches, stress headaches. In this neurology book on page 99, there's a whole section on tension type headaches induced by stress and emotional issues, even induced by overexertion. What happens when you overexert yourself? Do you get tight? Do you tense up? Do you feel inflamed in your neck and shoulders if you overexert yourself by shoveling too much snow? And if you get a headache afterwards, is that a migraine or is that a tension headache? It's a tension headache. Sleep disturbance. What qualifies as a sleep disturbance? Well, I can think of about 4,000 things, but you know one thing that qualifies as a sleep disturbance? Sleeping on your stomach with your head turned to your right for 8 hours at a time. Do you think maybe if you turned your head right now to the right and you left it there for the next 6 to 8 hours without moving it out of that position, do you think that that could cause a headache by increasing the tension in your neck and head? Sleeping on your stomach and side, if your head's put in that position, is a terrible idea, and it'll lead to headaches. But not migraine headaches like she's trying to tell you. They lead to tension headaches. Let's keep going and see what other brilliant ideas she's got here, okay?
Weather, bright lights.
Bright lights and loud noises? What's a common thread between those two things other than being extremely obnoxious? Oh, maybe that's just enough right there, right? When you hear loud noises and you get blasted with bright lights, what do? Do you go like this? Do you go like this? Yeah, right. Your body tenses up. And when your body tenses up because it's afraid or because it's been startled, guess what else happens? Your hormones change, your chemistry changes because you've brought into your person the stress response. And the stress response increases cortisol levels, like I mentioned before, which increases inflammation, and it does so in those muscles that you've just tensed up. And if those muscles happen to be in your shoulder and neck, which incidentally is the #1 region that mental stress is accumulated, guess what? You're going to be prone to a tension type of headache. Not a migraine headache, a tension headache. Let's keep going. Oh look, strong odors is up next. Strong odors, for some people, actually do trigger migraine headaches, and they're true migraine headaches. But strong odors could also potentially be classified with loud noises and bright lights. It could also lead to tension headaches, which can really be positively affected through completely different means. You're not getting these tension headaches because you lack ibuprofen or some other medication, right? You're getting them because of environmental factors that your body is not dealing with properly. Let's continue.
Loud noises and even strong odors. An additional trigger category is diet. Skipping meals and then eating fast foods that contain nitrates, such as hot dogs or lunch.
Now, I'll agree with the nitrate and nitrite thing. There are certain things that are put in foods that can absolutely trigger migraine headaches, like MSG. See it all the time. And eliminating those things from your diet is a good idea. She's right there. However, taking medications does not prevent you from eating these things. It just takes care of the pain afterwards. Additionally, if you have a really crappy meal, if you eat really outside of the zone of healthy, how does that make you feel? And what does that do to your body? Can you get physically ill and tighten up as a result of eating a crummy meal? Of course you can. Of course you can. So it could be chemical coming from the food, or it could be from the fact that you're stressed out that you just ate a bunch of crap. Let's keep going. This is fun.
Lunch meats can be enough to spark a migraine. Foods that contain MSG or foods that contain tyramine, such as aged cheeses, soy products, or smoked fish, can also initiate a migraine. Be careful with your alcohol intake, particularly red wine, and monitor your caffeine consumption. Too much caffeine or suddenly stopping caffeine have each been implicated in triggering migraines. In addition, some people find that aspartame, a sweetener present in many diet foods and soft drinks, leads to an attack. Many people consider stress to be the #1 risk factor for causing migraine.
The #1 risk factor for causing... Did I just hear that right? Did you hear that? Stress, the #1 risk factor for migraines. She doesn't know what she's talking about. She doesn't know the difference between a stress-induced tension headache that is written up in literature worldwide abundantly and a migraine headache. And let's just assume, because I've seen this, let's just assume that a tension headache gets so bad that it triggers a migraine headache. Is stress the cause of the migraine headache, or is stress the cause of the tension headache that causes the migraine headache? You see, I have found on many occasions that people who ultimately do have sort of textbook migraine headaches have them triggered by a tension headache that leads into the migraine headache. So rather than treating the migraine headache with a pain medication so you can get on with your day, if you treat the tension headache and the stress that leads to the tension headache before it ever materializes into a migraine, guess what? You don't ever have any migraines again. This right here is unbelievable. And again, they're trying to sell you pain medications for a stress-induced headache. Do pain medications decrease stress? Only if you're in pain and the pain is causing you stress. But it doesn't change your lifestyle. It doesn't change your life. It doesn't improve your body's function and help you manage your stress better. It just takes away the pain. It's not a solution to the problem. It's just a Band-Aid. Let's keep going.
When you experience stress, anger, or worry, your body secretes hormones that put you into a heightened state of alertness.
Oh, cortisol? I think we already talked about that. But as cortisol goes up, again, so does inflammation. And if you're already tight and inflamed from sitting at a desk all day, working at a computer, guess what that cortisol level jumping up might potentially do? It might trigger more tension, it's of course more inflammation, and it may lead to a tension type of headache.
Helping you be ready for whatever comes next. These chemicals cause a myriad of changes.
You know what? I don't think I can handle any more of this. This lady, this actress here, is telling you stuff that just isn't true. And if it is even remotely true, it's a stretch. There's a difference between migraine and tension headaches, okay? And the difference is that migraine headaches present completely differently. And most people have triggers, such as the chemicals she mentioned here before, that trigger those migraine headaches. Most commonly, these days, given the world that we live in and the work that we do, people are suffering from tension or stress type of headaches. These types of headaches are not only preventable, but you can get rid of them if you already have them. You don't need to take medication, and you certainly don't need to take painkillers that mask the underlying problem. If you're experiencing headaches, you must get a diagnosis, and it needs to be a good one. The default in America is you have migraines, and that is not sufficient to me, and it's not sufficient in my office. You need to get to the root of the problem and deal with the cause. I can help you with that. If you have any questions about migraine headaches versus tension headaches, I have other videos relating to those as well. But if you're stressed, if you're working at a desk, if you're doing things looking down all day, if you feel tight in your neck and then you get headaches, if they come on at the end of the day, if they come on when your boss is looking over your shoulder, there's a solution to the problem, and it's easy, and you don't have to be dependent on medications for it. Please let me know if you need help. I'm here for you.